Muscles anterior view. Number 1. Trapezius. It is a pair of large triangular muscles extending over the back of the neck and shoulders and moving the head and shoulder blade. Number 2. Pectoralis major. It is a thick, fan-shaped or triangular convergent muscle situated at the chest of the human body. Number 3. Bicep. It is a large muscle that lies on the front of the upper arm between the shoulder and the elbow. Number 4. Abdominal muscle. It is the muscles forming the abdominal walls. Number 5. External oblique. It is a broad, flat sheet of muscles on either side of the abs. Number 6. Abductor are the muscles that rotate an arm or leg to the side of the body. Number 7. Quadriceps. It is the large muscle at the front of the thigh, which is divided into four distinct portions and acts to extend the leg. Number 8. Gastrocnemius. It is a superficial two-headed muscle that is in the back part of the lower leg of human. Now let's go to the muscles posterior view. Number 9, just like number 1, it is also trapezius. It is a pair of large triangular muscles extending over the back of the neck and shoulders and moving the head and shoulder blade. Number 10, deltoid, is a thick triangular shoulder muscle. It is the muscle forming the rounded contour of the human shoulder. Number 11, triceps. It is a large muscle on the back of the upper limb of many vertebrates. Number 12, latissimus dorsi. It is a large flat muscle on the back that stretches to the side, behind the arm, and is partly covered by the trapezius on the back near the midline. Number 13, gluteus maximus. It is the main extensor muscle of the hip. Number 14, hamstrings. It is one of the three posterior thigh muscles in between the hip and the knee. Number 15, just like number 8, it is also gastrocnemius. It is a superficial two-headed muscle that is in the back part of the lower leg of human. Today, I'm Lexcie Bautista and I'm gonna talk about muscles. We have over 600 muscles in the body, but today we're gonna look at 22 of those. 22 common superficial muscles that control the movement of different joints. Alright, before we get into the muscles themselves, there's several terms that we need to learn. We'll start with some movements terms. The first one is flexion. Now, flexion is any time you're taking a joint and you're decreasing the angle of it. So, for example, whenever you contract the bicep muscles and bend the elbow, that would be an example of flexion. If you do the opposite movement and you extend the elbow or increasing the angle of that joint, we call that extension. So, flexion and extension are opposites of each other. The next one is the rotation. Rotation is just going to be turning a joint, and usually when we are talking about rotation, we need to indicate the direction. Next, we have the term abduction. Abduction, abduction is a movement away from the midline. So to abduct my arm, I'm going to take my arm and move it away from my midline. So that's just an example, okay? And the opposite of that is very similar sounding word, abduction. Think like it's addition. I'm adding my arm back to my torso. Ganon. So when I add to my arm and I return it back to my side or back to the midline, I can abduct the arm, but I can also adduct the arm. Even though these terms are pretty similar, I think it's a good way to remember them. Abduct and adduct. So now let's go to the muscles. The first one is deltoid. Deltoid are shoulder muscles, and their purpose is going to be to take the arms and raise them. Now, raising your arm is an example of abduction. So, abducting the arm is the function of the deltoids. Next is the biceps brachii muscles. The action of the biceps brachii muscles is to flex the elbow, and the origin of the biceps brachii is up in the scapula, and the insertion is gonna be the radius. So it's gonna pull between the scapula and the radius in order to flex the elbow joint. Now, its antagonist is the triceps brachii. The action of the triceps brachii is to extend the elbow joint. The triceps brachii originates at the proximal end of the humerus and it attaches to the ulna. Next is the pectoralis major muscle. The pectoralis is going to rotate your shoulder anteriorly. An example of a workout you can do here is the bench press because you're rotating your shoulders forward whenever you push the weights out. Next is the latissimus dorsi muscle. It is found in the lower back on both sides. So kung ang pectoralis major kanina, pectoralis major muscle, rotate the shoulder forward, si latissimus dorsi muscle naman, it will rotate the shoulder backward or it will rotate the shoulder posteriorly naman. Now, another important muscles to the shoulder is the trapezius muscle. It's kind of in the neck and the shoulders. Its origin is the thoracic and the cervical spine, as well as the base of the skull. Its insertion is in the clavicle in the scapula. Well, trapezius is all about moving your scapula. Semispinalis form the first layer of the muscles at the back. There are three parts, the thoraces, cervices, and lastly the capitis. The semispinalis capitis extends the head and the back. It rotates the head from the opposite side, and it is located in the upper back portion of the neck. The sacropinalis is at the back near the vertebral column, and it extends the length of the back. The sternocleidomastoid is at the side of the neck, and its function is to flex the neck. Next is the gluteal group. It is commonly called as buttocks. It is divided into three, the gluteus maximus, gluteus medius, and gluteus minimus. Its movements are extension, abduction, external rotation, and internal rotation of the hip joint. Now we go to the muscles that control the knee movement. First we have is the biceps femoris. Not to get confused with the biceps brachii, the biceps femoris is also called the hamstrings. So this is the back leg muscles and their job is going to be to flex the knee joint. Now let's go to the muscles that control the ankle joints. The first one is the gastrocnemius. Gastro means stomach, but this has nothing to do with your stomach, except for the fact na kung sino man ang nakadiscover ng muscle na ito at sinasabing it looks kind of the shape of the stomach, kaya pinangalanan na gastrocnemius, but its function is to extend the ankle. Its antagonist is the tibialis anterior. which is named because it's connected to the tibia and on the anterior side. The tibialis anterior connects to the tibia to the tarsal bones, and that's going to pull the foot upward, or it's deflection of the ankle, or dorsal flexion because it's flexing the ankle towards the dorsal side of the foot. The external intercostals, nasa outer surface of the ribs and are positioned at a diagonal in between each rib. Its function is lifts the ribs and rib cage and expands the anterior posterior dimensions of the rib cage. The antagonists of the hamstrings are the quadriceps. Now, the quadriceps are really four muscles. We have the vastus lateralis, rectus femoris, vastus medialis, and between those deep or underneath all of this is the vastus intermedius. Those four muscles make up the quadriceps. It is in charge of the extension of the knee. Inside the chest cavity, the diaphragm works to help with your breathing. When it contracts, the air fills into your lungs. When the diaphragm relaxes, it expands and forces the air out. That is how we breathe. Nakalocate ito sa base ng chest. Okay, from there, let's go to the abdominal muscle. Here we have the rectus abdominis muscle. Yung mga abs nyo, kung meron man, ito yung tinatawag na rectus abdominis muscle. The movement of the rectus abdominis is going to bend or flexion of the spine actually. Think about doing a sit-up and your spine sorts of bends. That's the action of the rectus abdominis, and that's why doing an ungodly amount of sit-ups could potentially maybe give you the six-pack you're hoping for. Laterally to the rectus abdominis are the external abdominal obliques. They're called obliques because they're not parallel. They kind of like a diagonal, so we call this obliques. And the external abdominal obliques do vary similar, but they can contact one of a time, which can bend you down like doing a sit-ups, but it is kind of to the side at nakatayo. The internal abdominal obliques, acting bilaterally, it support and compress the abdomen, raise the intra-abdominal pressure, and flex the vertebral column anteriorly. Acting unilaterally, the internal oblique laterally flexes. It is located in the lateral side of the abdomen. Next is the transversus, located in the inner surface of the anterior chest wall, and its function is to protect and stabilize the spine. Next, the orbicularis oris. It controls the movements of the mouth and lips. This muscle has four relatively distinctive movements. First, it presses together, closing the lips. It also tightens and tins the lips, and also rolls inward in between the teeth grimacing. And the last and most important thing that it does is the thrusting outward motion, which is pouting and kissing. It surrounds the orifice of the mouth. Lastly, the frontalis. Frontalis is muscle which covers parts of the forehead of the skull. In humans, the frontalis only serves for facial expressions. It is located on the front of the head. Its function is to raise your eyebrows, wrinkle your forehead, and move your scalp posteriorly or backward.
Good day, everyone. I am Airene Abad, and this is the completion. We will answer the completion together with the multiple choice. Number 1 question, what is the muscle tone and on what factor does depend? And the answer is, muscle tone is a small amount of tautness or tension in the muscle due to weak involuntary contractions of its motor unit, and the skeletal muscle contracts only after it is activated by acetylcholine. Ang acetylcholine ay major part of the somatic nervous system. So, within this system, it plays an excitatory role leading to the voluntary activation of muscles. Let's say, for example, the brain might send out a signal to move the right arm. The signal is carried by nerve fibers to the neuromuscular junction. It is released by nerve impulses in its motor neurons. Hence, muscle tone is established by neurons in the brain and spinal cord that excite the muscle's motor neurons. When the motor neurons serving a skeletal muscle are damaged or cut, the muscle becomes flaccid or flabby, a state of limpness in which muscle tone is lost. To sustain muscle tone, small groups of motor units are alternatively active and inactive in constantly shifting patterns. Muscle tone keeps skeletal muscles firm, but does not result in a force strong enough to produce movement. Let's say, for example, when you are awake, the muscles in the back of the neck are in normal tonic contraction. They keep the head upright and prevent it from slumping forward on the chest. Muscle tone also important in smooth muscle tissues, such as those found in gastrointestinal tract, where the walls of the digestive organs maintain a steady pressure on their contents. The tone of smooth muscle fibers in the walls of blood vessels plays a crucial role in maintaining blood pressure. Okay, let's answer number 2. Describe hernia. Hernia is the protrusion of an organ through a structure that normally contains it, which creates a lump that can be seen in or felt through the skin's surface. The inguinal region is a weak area in the abdominal wall. It often the site of an inguinal hernia, a rupture or separation of a portion of the inguinal hernia. Rupture or separation of a portion of the inguinal area of the abdominal wall, resulting in the protrusion of a part of the small intestine. A hernia is much more common in males than in females because the inguinal canals in males are larger to accommodate the spermatic cord or longinguinal nerve. And the treatment of hernias most often involves surgery. Surgery is the only solution to remove hernias and prevent potential complications that may arise during surgery. The doctor will sew the hole in the abdominal wall, which is mostly done with a surgical mesh. The organ that protrudes is stuck back into the abdominal cavity, and the defect in the abdominal muscle is repaired. In addition, a mesh is often applied to reinforce the area of weakness. What causes the hernia? Hernia is caused by combined effect of strain and weakness in the muscles and tissues. This strain or pressure pushes a tissue or an organ through an opening or a weak spot. Do you know what is the Tagalog of hernia? The Tagalog of hernia is luslos. Ito yung sinasabi nila na luslos sa mga lalaki. Pwede rin ito magkaroon sa mga babae. And question number 3. Describe the most common sites for abdominal hernias and discuss why hernias are most likely to occur in these locations. Inguinal hernia is the most common type of hernia. They occur when the intestines push through a weak spot or tear in the lower abdominal wall, often in the inguinal canal. The inguinal canal is found in your groin. In men, it's the area where the spermatic cord passes from the abdomen to the scrotum. This cord attaches to the testicles. And in women, the inguinal canal contains a ligament called the round ligament that helps hold the uterus in place. Inguinal hernias are more common in men because the testicles descend through the inguinal canal shortly after birth. The canal is supposed to close almost completely behind them. Sometimes the canal doesn't close properly. That's why the area will leave weak. So what will be the cause of muscle weakness? It is the failure of the abdominal wall to completely close in the womb. Tulad na ng unang nasabi ay pagkatapos manganak ay hindi tuluyang, not totally closed. That part. Chronic coughing. It can also cause the weakness of our muscle. Yung pag-ubo and aging. Surgical procedure or damage from injury. Factors that can put pressure in your body. This includes pregnancy, diarrhea or constipation, fluid in the abdomen, heavy weight lifting, yung mga pagbubuhat natin, nagiging dahilan din ito ng pagkakaroon ng hernia, a sudden weight gain, constant coughing or sneezing. What are the risk factors? Some of the risk factors that are associated with the formation of hernias are personal or family history of hernia. Ibig sabihin, kung lahi nyo ay mayroong hernia, there is a possibility that you will have a hernia. Being overweight or obesity. Obesity can also be the risk factor of having hernia or the formation of hernia. Smoking. Kasali din po ang smoking sa pagkakaroon ay magiging dahilan kung paano ma-form ang hernia. And the medication. Medication of this hernia is over-the-counter and prescription medication that can help reduce stomach acid, can also relieve the symptoms of a hiatal hernia. These medications include H2 blockers, antacids, and proton pump inhibitors. Okay, I'll give you a tips on living with hernia. Lifestyle changes such as switching to a healthy diet and regular exercising can help manage hernia. Practice breathing, exercises, and meditation. Drink at least 2 liters of water a day. Avoiding drinking, alcohol, and smoking. Manage your weight. Avoid heavy weight lifting. And correct your body posture. The signs and symptoms of inguinal hernia include a bulge that becomes more visible when the person is upright. Kung ikaw ay may discomfort and pain at the affected area, or a burning, gurgling, or aching sensation at the lamp. Kumbaga, parang pain, discomfort in the groin. A feeling of heaviness in the groin. Pressure or panghihina on your abdomen. And next question. Explain the difference between atrophy and hypertrophy. Discuss some causes of each condition. Okay. Atrophy is characterized by wasting or loss of muscle mass, decrease in the size. In contrast, hypertrophy is an increase in muscle mass. Palatandaan po natin dito sa atrophy and hypertrophy. In atrophy is means absence. Atrophy, decrease in size, decrease of a body part, cell, organ, or other tissue. The term implies that atrophied part was a size normal for the individual, considering age and circumstance prior to the diminution. In atrophy of an organ or body part, there may be a reduction in the number. Ibig sabihin, bumababa ang number or size of component cells in both. Muscle atrophy can occur due to malnutrition, age, genetics, a lack of physical activity, yung mga hindi gumagalaw-galaw, or certain medical conditions. Sila yung mga tao na hindi masyadong gumagalaw yung katawan nila. This use physiologic atrophy occurs when you don't use muscles enough. Gaya ng sinabi ko nung una ay hindi na-exercise ang mga muscle. Neurologic atrophy occurs due to nerve problems or diseases. Dito naman tayo sa hypertrophy. Ang palatandaan natin dito sa hyper means pagtaas, hypertrophy. And some male want six-pack abs, diba? Yun naman yung yung kadalasan. But before that, have you ever heard the term hypertrophy? Okay, you've probably heard big guys at the gym tossing around the word hypertrophy when they talk about their lifting goals. But what does that even mean? Are the principles behind the term just some sketchy bro science, a passing fitness, fad, or real lab tested and proven physiology? Rest assured, the hype is real. Hypertrophy is the enlargement of an organ or tissue from the increase in size of its cells, not to be confused with hyperplasia. Ma'am Arich explained it before that hyperplasia is the increase in number of cells, the process of increasing number of cells. Hypertrophy is the This occurs through a physiologic process that leads to an increased number of contractile proteins, actin, and myosin. In each muscle fiber, with the right training regimen, you can catalyze this process but helps to understand the science behind it. The body has the amazing potential to adapt to its environment. This includes building more strength. Nag-gain ka ng strength when repeated stress to the tissue. Just like, for example, at the gym, you are gaining stress to the tissue. It indicates a need to accommodate the new higher loads. This is exactly what the process of strength training does. When it comes to building muscles, hypertrophy doesn't just happen on its own. It has to be triggered by a physiological need. Okay, number 5, the question is, explain the difference of flaccid paralysis and spastic paralysis. Flaccid paralysis causes your muscles to shrink and become flabby. It results in muscle weakness. Spastic paralysis involves tight and hard muscles. It can cause your muscles to twitch uncontrollably or spasm. Spastic sometimes is offensive name for a person who has cerebral palsy. It is a tabos lang clumsy and incapable or incompetent person. Paralysis is loss of motor function. So when we add it, flaccid paralysis is muscle that loss of motor function. And the difference of the two is flaccid is muscle tone less than normal, and spastic muscle tone is more than normal. Muscles become weak in flaccid, and in spastic muscle become tight and rigid. Flaccidity, muscle loss is common. Spasticity, muscle loss is rare. Take note, flaccidity have no involuntary movement. In spastic, involuntary movement are present. Flaccid have lower motor neuron, and the spastic have upper motor neuron lesion. And last, flaccid have it is a muscle atrophy. If you remember, atrophy is absence, and the spastic have no muscle atrophy. Okay, let's go on to the next question. Describe fibrillation. Fibrillation is a muscle twitching involving individual muscle fibers acting without coordination. It is abnormal contraction of skeletal muscle. Ito yung spontaneous contraction of a single muscle fiber that is not visible under the skin. Pero it can be recorded by electromyography. Pwede siyang ma-record sa electromyography in signal destruction of motor neurons. Skeletal muscle fibrillation refers to small local muscular contractions that occur in response to spontaneous activation of single muscle fibers, which then contract independently of surrounding fibers. These relations have been described in cases of certain muscle disorders such as muscular dystrophy, polymyositis, and amyotrophic lateral sclerosis. It is a condition in which muscle fiber regeneration or denervation are often or very often present. However, they are considered to be a defining characteristic of motor nerve destruction to the skeletal muscle fiber in humans and in animal models of spinal cord injury and peripheral denervation. These spontaneous fibrillation are often used clinically to determine the severity and magnitude of neural injury and nerve regeneration status. It also has been proposed that these fibrillations could be useful in assessing the muscle atrophy occurring subsequent to denervation. Then now we will go with the discussion of low back pain. Low back pain is most common causes of low back pain are the strains and sprains. Any injury of the muscle and ligaments that sumusuport in your spine ay nagiging cause ng back pain. Injury can occur while lifting a heavy weight improperly or for posture of being overweight. I will mention the most common causes. It is the number 1, herniated disc. The intervertebral disc protective outer layer might break away over time. The soft inner disc tissue may push through the outer layer. The disc, ito yung bulge or slip out of place na kilala sa herniated disc, bulging disc, or slip disc, and may press on nerve roots, leading to symptoms such as pananakit, tingling, numbness, or weakness in the area that nerve root supplies. Number 2, disc degeneration. Going back to number 1, yung this nerve runs down your lower back through your hips and buttocks, down on each leg. Sciatica is how common people refer to pain that travels down the leg from the lower back. Although, yung doctor mo may use the term lumbar radiculopathy. Number 2, disc degeneration. While the word may sound frightening, it just implies you have a damaged disc that is giving you discomfort. That disc begin to wear away and shrink as we age. In some cases, they may entirely collapse, causing the facet joints to rub against one another. Pain and stiffness result. This wear and tear on the facet joints are known as osteoarthritis. Ito yung sinasabi nilang parang may arthritis na ata ako, sakit ng mga kasukasuan ko. The pain gets worse with movement. Saka kapag gumagalaw sila ay lalong lumalala yung pananakit. Ito ay dahil sa your disc collapse and osteoarthritis develops. This is the time that osteoarthritis develops in your body and respond by growing new bone in facet joint to help support the vertebrae. This bone overgrowth called spores can lead to narrowing of the spinal canal. The spinal stenosis. Osteoarthritis can also cause the ligaments that connect the vertebrae to thicken, which can also narrow the spinal canal. Spinal stenosis. Ito yung nangyayari ito in both upper cervical spine and the lumbar spine, but lumbar spinal stenosis is more common. Number 3, spondylolisthesis. It is a condition where your vertebra can slide forward on the top of another. If too much slippage occurs, the bones begin to press on the spinal nerves, resulting in weakness of muscles and bowel and bladder disturbances. Osteoporosis. Number 4. Ito na yung sinasabing osteoporosis. Can cause low back pain. Dahilan din ito para magkaroon ka ng low back pain. Ito ay condition that makes your bones brittle and porous. Ibig sabihin, the compression fractures occur when too much pressure is placed on the weakened vertebra. The thin bone may even break with everyday activity. In severe osteoporosis, the vertebral bone completely collapses. Multiple fractures cause severely rounded back. Number 5, infections of the spine. Infections of the spine like TB and non-TB infections can cause back pain. Infections of disc and bone can cause severe pain and require prompt medical attention. If you encounter infection of the spine, you are required in prompt medical attention. Number 6, abnormal shape of the spine. Some conditions make your spine to develop abnormal shapes like kyphosis, increased or forward bending of the spine, scoliosis, side bending of the spine, and excessive lordosis. Number 7, inflammatory back pain. They are usually associated with multiple joint pains and morning stiffness. 8 is rheumatoid arthritis. Psoriatic arthritis are some examples. Number 9, sacroiliac joint pain. Your spine is connected to your pelvis on both the sides by the sacroiliac joints. And the other condition that can cause low back pain is cancer of the spine, bladder infection, kidney stones, kidney infections, pelvic inflammatory disease, sleeping disorders. Posture related. Some daily activities and poor posture can cause back pain. These include awkward bending movement, including spine, forward bending, and lifting heavy weights. Yung pagbubuhat natin ng mga mabibigat can cause back pain. Standing or sitting for a longer time. Yung pag-upo natin, for example, nag-online class ka, magkakaroon ka ng lower back pain if you have improper sitting position, improper sleeping postures, improper sitting posture while driving or using a computer and using mobile phone. When is lower back pain an emergency? Others may ask, when is lower back pain will cause emergency? Although most episodes of lower back pain subside on their own, they are occasions when you should seek medical attention. Take note, there are occasions when you should seek medical attention immediately. These conditions include accident, injury, other trauma, fever, kung nagkakasakit ka na, and unexplained weight loss of appetite. weakness develop in the legs or feet. Nagkakaroon ng panghihina sa mga legs mo, sa mga paa mo dahil sa lower back pain. And hindi mo na makontrol yung pag-ihi and stall or urinary retention. You have a previous history of cancer, or the lower back pain is severe and constant, hindi nawawala, and suddenly progressive worsens, namamaga and doesn't go away. That is immediately seek medical attention. And if the pain interrupts sleep, hindi ka makatulog dahil sa pananakit ng back pain. The treatment of lower back pain is most of the time on its own, meaning kusa lang itong gumagaling. You may begin by practicing home care techniques such as taking rest, ice, and heat packs. However, in some cases, it requires medical or surgical treatment. The treatment is cause specific, and the medication of lower back pain is based on the severity. It depends on the severity. Your doctor might prescribe you pain relievers, muscle relaxants, topical pain relievers, and antidepressants in chronic pain. These medications are to be taken under the guidance of your doctor. Otherwise, they will result in serious side effects. Now, let's go to the explanation of physiology of muscle contraction. When scientists examined the first electron micrographs of skeletal muscle in the mid-1950s, they were surprised to see that the lengths of the thick and thin filaments were the same in both relaxed and contracted muscle. It had been thought that muscle contraction must be a folding process, somewhat like closing an apple jar. Instead, researchers discovered that skeletal muscle shortens during contraction because the thick and thin filaments slide past one another. The model describing this process is known as the sliding filament mechanism. The sliding filament mechanism is muscle contraction occurs because myosin heads attach to and walk along the thin filaments at both ends of sarcomere, progressively pulling the thin filaments toward the M line. The figure shows the result. As a result, the thin filaments slide inward and meet at the center of sarcomere. They may even move so far inward and that their ends overlap. As the thin filaments slide inward, the Z-disc come closer together and the sarcomere shortens. However, the length of the individual thick and thin filaments do not change. Shortening of the sarcomere causes shortening of the whole muscle fiber, which in turn leads to shortening of the entire muscle. And this is the contraction cycle. At the onset of contraction, the sarcoplasmic reticulum releases calcium ions into the sarcoplasm. There they bind to troponin. Troponin then moves streptomyosin away from the myosin binding site on actin. Once the binding sites are free, the contraction cycle, the repeating sequence of events that causes the filaments to slide, begins. The contraction of cycle consists of 4 steps. Number 1 is ATP hydrolysis. The myosin head includes an ATP binding site, and an ATP is an enzyme that hydrolyzes ATP into ADP, adenosine diphosphate, and phosphate group. This hydrolysis reaction reorients and energizes the myosin head. Notice that the products of ATP hydrolysis and adenosine diphosphate and a phosphate group are still attached to the myosin head. Number 2 is attachment of myosin to actin to form cross bridge. Energized myosin head attached to the myosin binding site on actin and releases the previously hydrolyzed phosphate group. When the myosin head attached to actin during contraction, they are referred to as cross bridges. Number 3 is it will go into power stroke. After the cross bridge form, the power stroke occurs. During the power stroke, the site on the cross bridge where ADP is still bound opens. As a result, the cross bridge rotates and releases the ADP. The cross bridge generates force as it rotates toward the center of sarcomere, sliding the thin filament past the thick filament toward the M line. Number 4 is the detachment of myosin from actin. At the end of the power stroke, the cross bridge remains firmly attached to actin until it binds another molecule of adenosine triphosphate. As adenosine triphosphate binds to the adenosine triphosphate binding site on the myosin head detaches from actin, and the contraction cycle repeats as the myosin ATPase hydrolyzes the new bound molecule of adenosine triphosphate and continues as long as adenosine triphosphate is available and the calcium level near the thin filament is sufficiently high. The cross bridge keep rotating back and forth with each power stroke, pulling the thin filaments toward M line. Each of the 600 bridges in one thick filament attaches and detaches about 5 times per second. At any one instant, some of the myosin heads are attached to actin, forming cross bridge and generating force, and other myosin heads are detached from actin, getting ready to bind again. As the contraction cycle continues, movement of cross bridge applies the force that draws the Z disc toward each other, and sarcomere shortens during a maximal muscle contraction. The distance between two Z discs can decrease to half the resting length. The Z disc in turn pull on neighboring sarcomeres and the whole muscle fiber shortens. Some of the components of muscle are elastic. They stretch slightly before they transfer the tension generated by the sliding filaments. The elastic components include thin molecules, and it is connective tissue around the muscle fibers. They call the endomysium, perimysium, and epimysium, and tendons. Are you in with me? Okay, let's proceed to the multiple choice. With respect to the thigh, the hamstring are located, and the answer is letter B. Because when the thigh is flexed with the knee extended, the flexion of the hip joint is restricted by the tension of hamstring muscle on the posterior surface of the thigh. So most of us can raise a straight leg more than 90-degree angle from the floor. Number 2. Circumduction is performed at the joint of the letter D, wrist, because circumduction are moving the humerus in a circle at the shoulder joint, moving the hand in a circle at the wrist joint, moving the thumb in a circle at the metacarpal joint, moving the fingers in a circle at metacarpophalangeal joints between the metacarpals and phalanges. And number 3, the axial skeleton contains the bone of the letter D. The axial skeleton consists of bones arranged along the longitudinal axis. The part of axial skeleton are the skull, auditory, ossicles, ear bones, hide bone, vertebral column, sternum, and rib. The appendage skeleton consists of the bones of girdles and the upper lower limbs. Number 4. Connective tissue that attach muscle to bone is letter D. Tendons. Tendons are connected muscle to bone, made of fibrous tissue and collagen. Tendons are tough but not very stretchy. Number 5. Letter B. In early adulthood and middle age, bones neither grow nor shrink because letter B, most people will reach their peak bone mass between the age of 25 and 30. By the time we reach age 40, we slowly begin to lose bone mass. We can, however, take steps to avoid severe bone loss over time. For most of us, bone loss can be significantly slowed through proper nutrition and regular exercise. Number 6 is letter A. Mastoid process is part of the temporal bone. It is posterior component. The inferior conical projection of the mastoid part is called the mastoid process. Number 7. The opening in the occipital bone through which is the spinal cord communicates with the brain is called the letter C. Foramen magnum. The foramen magnum, the opening through which the brain and the spinal cord make connection. Number 8. The muscle located from the sternum and clavicle to the temporal bone that to flex and rotate the head is the sternocleidomastoid. The sternocleidomastoid muscle is two-headed neck muscle which through to its name bears attachment to the manubrium of sternum, the clavicle, and the mastoid process of temporal bone. Number 9. The contractile process of smooth muscle is similar to that of skeletal muscle, except that smooth muscle uses. The answer is less ATP, and both the contraction and relaxation phases are slower. Smooth muscle are slowest to contract and to relax. Skeletal muscle are large multinucleate cells that appear stripped or striated under the microscope. Cardiac muscle are also striated but are small branch and unnucleate cells are joined by series of junctions called intercalate discs. Number 10. Cells concerned with the absorption and removal of bones are letter C, osteocytes. Its function is to absorb and remove unwanted tissue. Osteocyte, this type of cell is within the bone. It helps to maintain bone as living tissue. Number 11. The two innominate bones of the pelvic girdle unite to form the pubis. The pubis is the most forward-facing bone of the pelvic bones together with the ilium and ischium. Number 12. The appendage skeleton contains the bone of the shoulder and vertebral column? The answer is B. The appendicular skeleton includes the bones of the shoulder girdle. The pelvic girdle is a ring of bones attached to the vertebral column. Number 13. The type of bone marrow that is found in all cancellous bone of children but only in the cancellous bone of the vertebrae, hips, sternum, ribs, cranial bones, and proximal ends of the femur and humerus of adult is letter C. Red marrow. Cancellous bone is comprised of spongy, porous bone tissue that is filled with red bone marrow. Number 14. The bone that articulates with the sternum and extends laterally to the letter A, clavicle. The clavicle is an anterior bone whose sternal end articulates with the monobrium of the sternum at the sternoclavicular joint. That's all my part. Thank you.
Good day everyone, my name is Emily Grace Ancheta. Today I'll be explaining these 10 questions with their right answers. So question number 1 is, the condyle of the mandible articulates with the fossa of the temporal bone. The answer is true because it articulates against the glenoid fossa, also called mandibular fossa, which is part of the upper temporal bone. Question number 2. The head of the femur articulates with the obturator foramen of the inguinate bone. The answer is false because the head of the femur, which articulates with the acetabulum of the pelvic bone. Question number 3. The costal cartilage of true ribs are attached directly to the sternum. The answer is true. The true ribs are connected directly to the breastbone or sternum by strips of cartilage called the costal cartilage. 4. The posterior fontanelle is located between the coronal lambdoidal sutures. The answer is false. The posterior fontanelle triangular in form and situated at the junction of the sagittal sutures and lambdoidal sutures. Question number 5. A sinus is a cavity or space within a bone. The answer is true. So sinus in anatomy is a hollow, cavity, recess, or pocket. A large channel containing blood, a suppurating tract, or a cavity with a bone. Question number 6 is, tuberosity is the part of bone for articulation. The answer is false because the tubercle consists of an articular and a non-articular portion. Question number 7. The transverse process is the part of the vertebrae felt under the skin of the back. The answer is true. The vertebral spines can easily be felt as a series of bumps just under the skin down the middle of the back. Question number 8. As muscles contract, they become shorter and thicker. So the answer is true because muscles contract and relax, resulting in movement of limbs. Muscles become shorter, stiffer, and thicker within it contracts. Question number 9. The two innominate bones unite anteriorly to form the symphysis pubis. The answer is false because the two innominate bones unite anteriorly at the symphysis pubis. Nanggagaling siya sa symphysis, hindi siya nagfo-form ng symphysis. And number 10, last question is, posterior to the ethmoid is the sphenoid bone. The answer is true because the ethmoid bone adjoint the sphenoid bone.
Hi, I am Laarni, the next reporter. Define and provide a picture of each. Number 1, we have the lordosis. Lordosis is the inward curve of the lumbar spine just above the buttocks. Lordosis basically described as the backward curvature of the spine, and it is also sometimes called sway back. Kadalasang symptoms ng lordosis ay spinal deformity of lower back, which looks like letter C when viewed from the side. Isa sa mga dahilan kung bakit nagkakaroon ng isang tao ng lordosis is because of the lower back pain dahil yung spinal cord or nerve roots ay nagko-compress. Pero sa mga buntis, normal naman ang magkaroon ng lordosis kasi mawawala din ito after birth. Number 2, we have the scoliosis. Scoliosis is an abnormal lateral curvature of the spine. It is most often diagnosed in childhood or early adolescence. It is a condition where spine has an abnormal side-to-side curve. Most cases of scoliosis have no known cause. Sa ibang cases, scoliosis may be present after birth, but in other cases, it may occur over time, and other causes may include such as paralysis, osteoporosis, or even spinal fractures. The next one is we have the kyphosis. Kyphosis is a condition where the spine curves at an increased angle causing a rounding or hump to form around the upper back or shoulders. Ang kyphosis is an exaggerated forward rounding of the back. Ito yung tinatawag nating kuba, and it can occur at any age but is most commonly sa mga matatanda na or sa meron din yung tinatawag nating post-traumatic kyphosis wherein ito yung mga taong na aksidente na operahan noon sa likod. So, ang nangyari, naging problema yung structural support at nagkaroon ng deformity. Number 4, we have the epicondylitis. Epicondylitis is an inflammation or damage to the area of the epicondyle of bone. An epicondyle is a projection of bone above a condyle around the prominence at the end of the bone, usually where the bone connects to the other bone, where ligaments and the tendons are attached. Actually, there are two common types of epicondylitis. Meron tayong tinatawag na tennis elbow and golfer's elbow. Sa tennis elbow, it is also known as lateral epicondylitis, which is an overuse injury to the area of the lateral or the outside epicondyle of the elbow and of the upper arm bone or the humerus. Sa golfer's elbow naman, or the medial epicondylitis, ay ang overuse injury similar to tennis elbow. Pero sa case na ito, the damage occurs in the area of the medial or the inside epicondyle of the upper arm bone. Number 5, we have the rheumatoid arthritis. Rheumatoid arthritis or RA is a chronic, progressive, and disabling autoimmune disease. It causes inflammation, swelling, and pain in around joints and can affect other body organs. Ang rheumatoid arthritis ay inaatake niya mostly yung mga small joints sa ating mga kamay, sa paa, but most of the time, sa kamay sila umaatake sa may bandang knuckles, both left and right. Hanggang ngayon, sa mga pag-aaral or the researchers, wala pa rin diretsong cause kung bakit nagkakaroon ng rheumatoid arthritis. But may sinasabing may kinalaman daw ito sa genetics and triggers factors like previous infections and viral infections. Number 6 is we have the osteomyelitis. Osteomyelitis is an inflammation or swelling that occurs in the bone. It can result from an infection somewhere else in the body that has spread to the bone, or it can start in the bone often as a result of an injury. Osteo means bone, myeli means bone marrow, and itis means inflammation. Pwede itong maka-apekto both children and adults, but mas madalas ito makita sa mga bata. Itong infection na ito ay pwedeng pumasok sa iba't ibang parts ng ating mga katawan through skin cut and other infections. Pero kapag na-diagnose ng maaga, ang osteomyelitis can be successfully be treated with antibiotics. But pag hindi naman nabigyan agad ng treatment, it can lead to more serious complications. Number 7, we have the osteoporosis. Osteoporosis is a disease that thins and weakens the bones. Dito naman sa osteoporosis, osteo means bones and porosis means pores. Ang main cause nito ay ang kakulangan ng katawan natin ng vitamin D at calcium, kasama na rin ang pagkakaroon ng fracture o pagkabali ng bato. Most commonly na nagkakaroon ng osteoporosis ay ang mga babae, lalo na kapag nagme-menopause. Number 8, we have the hernia. Hernia is a tear in your muscle or tissue that allows part of your insides to bulge out. It can be a bulge or an internal organ or your intestines. Ang hernia ay yung umuusling organ ng isang tao, mostly yung mga bituka sa bahagi ng katawan ng tao. Pwede ito sa pusod, sa area ng sikmura, sa singit, sa likod at marami pa. Sometimes you can see hernia depending on its location and size. Certain activities can worsen the condition like bending over or lifting heavy objects. Most common cause nito ay congenital or kakapanganak lang sa taong may edad na, sa lalaki, at sa may mga chronic cough. Number 9 we have the strain. The strain is when a muscle is stretched too much and tears. It is also a pulled muscle, and a strain is painful injury. It can be caused by an accident, overusing a muscle, or using muscle in the wrong way. Example of commonly caused ng strain is kapag natapilok ka, kapag nagbabasketball, di ba? Kasi mostly, nagkakaroon tayo ng strain kapag mga lalaki nagbabasketball. And kapag natapilok ka, it can either may stretch yung or mapupunit yung ligament mo sa kahit anong joint na affected. Kaya tayo nagkakaroon ng strain sa ating mga muscle. And number 10 is we have the sprain. A sprain is a stretching or tearing of ligaments, the tough bands of fibrous tissue that connects to bones, tougher inner joints. Ang most common location ng sprain is, syempre, alam naman natin sa may ankle. And kapag nagkaroon pala tayo ng sprain, ang initial treatment nito ay ang mag-rest ka, lagyan mo ng ice at compression. So, we have the matching type. Number 1, our answer for this is letter N. Letter N is a bony process on upper end of the femur where certain muscles are attached. Number 2, we have the collagen. And our answer for this is letter C, protein constituent of the bone. Number 3, we have the osteoblast. And our answer for this is letter K, or produce bone. And number 4, we have the Herversian systems. Our answer for this is letter I, concentric lamella surrounding a canal in compact bone. And number 5, we have the inferior thoracic joints. And our answer for this is letter B, ends of long bones. Number 6, ossification, or the letter O, deposition of calcium salts into bones. Number 7, we have the acetylcholine. Our answer for this is letter A, chemical mediator of nerve impulses. Number 8 is we have the osteoclast. Our answer for this is letter L, cause absorption of bone. Number 9, we have the synarthrotic joint. And our answer for this is letter F, immovable joints. Number 10, diaphysis. Letter G, shaft of bone. Number 11, osteocytes, or letter M, osteoblasts embedded within the bone. Number 12, we have the hematopoietic, and our answer for this is letter J, blood building tissue. Number 13, we have the epiphysis, or the letter D, ends of long bone. We have the number 14, tuberosity. And our answer for this is letter E, bone projection where muscles are attached. And lastly, we have the diarthrotic joints. And our answer for this is the letter H, the freely movable joints.